you take it that time, but don't take it that blanket. It's tough. Look, tame. You can take it off. We can cut it later.
Okay. All right, and 3, 2, 1. So good afternoon, and we're starting to do a full body massage, and we're going to start from the top of the body, and when she's facing down will be the back. Afterwards, we'll start the upper extremities on both the right and left arm down to the fingers, and then we will go down to the lower extremities all the way down to the ankle. If they wish to have their feet rubbed or massaged, that is totally up to them, and that'll be a separate massage in itself. So right now, we're going to take the blanket and the sheet, and we're going down to the lower back. Make sure it's nice and secure. Make sure any wrinkles or anything, make sure it's totally comfortable. At this time, we want to make sure they're totally relaxed, that their head is perfectly aligned with the body, and making sure there are nothing else to worry about while you're doing the massage. You will then take the preferred hot oil, because some people like it a little warmer and or sometimes a little hotter than most. You will start going to the scapula or the shoulder blade, towards the spine, towards the other scapula, and giving yourself a little bit more to work with. You want as much oil to work with to where it has the amount of area to reach in the back. Starting out all over, you want to do what's something like a search and exploratory massage area. You want to see where, in fact, the patient has any sort of muscle tension, any sort of knots or discomfort. Now you would wish to talk to the patient beforehand to ask where any pain, discomfort, or areas of concern. You're going to go down to the shoulder region and give it a light rub here. Then you may continue to go into the areas more towards the neck and or towards the deltoids or the outer side of the shoulder. And then when you go back in towards the spine, you want to locate the shoulder blade or scapula. And then you wish to go right towards the end of the shoulders and back towards the outer rim of the shoulder blades. You never want to apply direct pressure on the spine itself, as for it will cause discomfort, and you never want to rub directly on a bone. So there are deeper levels of massage, hence why they call it deep tissue. They can call it Swedish, and they can call a lot more reflexology to that effect. What you want to do is go down right here to the shoulders and give it a light rub. You never want to pinch or apply too much indirect pressure to where it will cause more of a discomfort. You wish to start here, work your way down. Now the thoracic or the middle section of the spine right here too is particularly an area of discomfort, especially for women, because they have the wire for the bra or they have a lot of tension when having to support themselves in their posture. So right here, you wish to focus not the entirety of your massage, but to where you give it a lighter and more of a general concern whenever I'm starting a massage. Starting at this point, you wish to go to the lower back of the lumbar region. The lower back of the lumbar, 1, 2, 3, 4, and 5. The fourth lumbar area too has the thickest and densest bone of that region. So be sure to increase the awareness while applying pressure right here. The S1, S2, also known as the tailbone, that's going to be a region closer towards the end of the spine, in which case you want to be particularly delicate because the sciatica nerve is located right in this region. So if they have any surgery, any history of lower back pain, that is a direct region of concern if in fact you're applying pressure. Shooting pains can occur on the left or right side of this region. So when applying pressure for a massage, you wish to apply just enough to where the patient has any other sense of discomfort, any other concerns, or tingling sensation. So when applying with your thumbs, with your index finger, middle finger, or generally with your palm or the side of your hand, you wish to just give it a average amount of pressure and then apply further if they requested so. Once going into the kidney regions in the area here, you wish to apply overall pressure, not direct pressure. The organs and functions on this region too are specifically sensitive to some people, but nonetheless, they require to be ever so much more with the amount of oil you use, as well as the pressure being applied. So when starting at the top, when you begin your massage, you wish that the neck, the hair, and jewelry are completely out of line, out of the area of the concern. And when applying pressure, you wish to have overall control and degree of comfort. After which, when the patient has received the amount of time for that back while facing down, you're going to take out your first extremity, right or left. You're going to apply 1 coat of oil. If you require 2 coats because of the size of the patient or your general understanding of what you would require, it's totally up to you. You are going to take the extremity, going down inside the armpit right here. You're going to rotate the thumb pointing downward for the comfort of the patient's sake, as well won't be twisting or making any involuntary movements. You're going to maintain alignment, but also making sure there's no undue tension from the patient itself, meaning that if the patient isn't totally relaxed, this is how it should be. They would not be rigid and or resisting, so to speak, to when having to apply this kind of massage. So, maintaining full control of the extremity, you're going to apply overall pressure in a sense where the forearm, which is this region right here, is experiencing a release from the elbow to the wrist. So, understanding that maintaining the thumb down towards the floor and maintaining that balance. You do not at any time want to reach up from the elbow facing up towards anywhere past the 90-degree parallel to the deck. Once that is a rotation of comfort, meaning that the area is either 45 degrees, 9 degrees, parallel right here, or a 15-degree angle down towards the patient in this region. Now, reason why these are angles of understanding or concern is because some patients come in with shoulder injuries, muscle tension, or tissue damage. So trying to do the reflexology in this sense is imperative, because when trying to reach and or trying to relieve the pain, it can be at this angle or others. But you wish to try all the above because you want to get the most amount of tension released. So once you are getting the most amount of pressure relief, you're then going to bend the elbow 45 degrees here, place it upwards, and put the patient where they have just enough comfort on the side to where it is not hanging over or it is too close to where they feel compressed. You wish to repeat the same thing for the opposite extremity. Once that is complete, you're going to do a full wipe down with a hot towel and make sure that there's very little oil left in the patient itself. While maintaining the communication with your patient, you wish to say, is everything okay? Is everything comfortable? Can I focus on anything else while I'm in this position to massage this area or in this time frame? Once you've communicated, do as they wish, please. And after the wipe down of the hot towel, you are going to cover the patient right towards their neck while making sure that it's not too hot or too cold. You want to make sure the temperature balance is always constant. Once that area is complete, while facing down obviously, you will then proceed to the lower extremities. Also, if they choose to wear socks or any other, let's just say, garments underneath, you wish to say what area is under concern. So you will have from the calf to the joints, preferably around the popliteal artery, right behind the kneecap. You will then go to the hamstring area or the back of the thigh right here. Remember, these areas go right up to the gluteus minimus and as runs to gluteus maximus. So when you have total exposure of this region, you wish to have it not so much clamped together, so maintaining a balance, so equidistance of both lower extremities will be preferred, not only towards your access, but also towards patient's comfort. Maintaining patient communication and comfort is paramount with any massage or any therapy given. Once you apply the massage oil, as I'll be in this position. You wish to apply 2 coats from the top, down, and up. You will then, as before instructed from the back, exploratory, making sure you are getting total coverage for all oil, and wish to go only where the patient asks to, meaning if she specifically says, do not touch the feet or go towards the feet, you're only going down as far as the ankle and the Achilles tendon right here, which can also be very sensitive in itself. When females, preferably ones who wear heels, this area can be extremely sensitive. So applying only so much pressure in the median area, that's going to be good. You never want to directly go over the Achilles tendon. You wish to go onto the sides. As I said before, it can be very sensitive and very much, cautious area. You want to maintain a good positive control on the lower extremities, meaning you wish to pull only so much and grasp on the areas to where the muscle group, which is at the point, this calf muscle is the biggest point right here, and make sure that it goes only towards the popliteal artery, having to cut off circulation right here, and then increase pain is not something you wish to do. So you wish to only go to the maximum degree of the muscle group itself. The joint areas, or the part where the kneecap is going to be in connection to this, you wish to gather how much angle it is towards the comfort. So equidistance is perfectly fine, but in a sense, like we tried before, reflexology, you wish to gain the understanding of what the total comfort and or the range of motion should be. After which, you go right above the popliteal artery. Now, increasing circulation and reducing the inflammation is key. So in this area, if you feel tension from the joints and or any tensions in the muscle groups, you wish to apply just a light pressure in this region. Now, from the knee to the gluteus minimus, this is the hamstring. Now remember, the femoral artery, the femur bone, and the thigh is the largest muscle group in the body besides gluteus minimus. So when applying the pressure here, you wish to give the forward motion going up towards the head of the patient. Reason why this is because the muscle group is going from low to high, hence why I'm going from high to low. So just like a salmon going up with the current, salmon and tuna, all the things they go for is they go against the resistance. So we're going from the lowest point of resistance to the highest. And we're going to stop right here. And if the patient wishes to massage any area on the hips or the pelvis area too, that is at their request only. For right here, the maximum amount of tension for the maximum amount of relief. That's what we're going for every time. So going towards the outer and inner thighs right here is also an area of tension. But remember, keeping this equidistance is paramount. You do not ever want to be sure having line of sight or a degree of comfort for the patient. So the thumbs are a good use in this area for total control and positive control. Right here, you can use your 3 fingers, which is the middle finger, the index, and the ring. So applying so much pressure right here is a good region, and you wish to have the from starting below going up. So using your palm is a good technique in the total coverage of the area, but at the time, you wish to maintain the total control as well as where these specific areas of tension, because the patient, as I said before, will usually direct you. And if they don't, you will do exploratory. You will find the areas, the knots, the tension, or whatever it is of concern to lower that and give the patient a amount of relief. Once that is, this concern is addressed, you will then go down towards the calf again while bringing all the circulation and all the tension down to the lowest part possible and giving that positive control from start to the end and making sure the patient's tension as well as the comfort is addressed from the very beginning to the end. And once that is done, you will take the hot towel, wipe down all over, and make sure that the patient is properly covered. At the same time, maintaining positive and total communication, as well as understanding for what the patient's needs can be met, meaning after you are done with your initial massage in the relative region, you say, is there any of the areas while we are in this position to continue and or go over again? So, Miss Jenny, are you okay now? Okay, we are ready for you to turn over, so please do so. Okay. Once the patient has flipped from the prone position to supine, or from the face, now that she's on the head, we're going to maintain her head in position because, of course, they cannot see or do what we do since we have the overwatch, so to speak. So, Miss Jenny, would you please take your head up and scoot back very slowly?
Scoot back.
Scoot back, yes. Keep going, keep going. One more time, a few more inches. Almost there, one more time. Okay, good. All right. Make sure your hair is out of your way. Is that good?
Mm-hmm.
Okay. So once that's complete, make sure that all the sheets and drapery are even, because you hate to have those things just think, oh, let's see what's there, all these things around me. So once you have patient's head aligned perfectly, you can see it's 90 degrees as such too, not going chin down to the chest or arch back right here. You then communicate and you then start your next available. So the first thing we would want to do, as stated before, whenever they're facing down to, going for the shoulders. So taking your stool or whatever kind of seating position you wish to have, you will go to the head of the patient. If you have limited amount of space, room for your therapy, I say just try to augment and or try to modify as best as possible for the region. If you need to do one side or the other and then rotate after that stuff too, whatever works for you. Again, at the end of the day, patient comfort and communication is paramount. Now, if you're redoing this scenario again, meaning if you're already gone to the shoulders and wipe them down with a hot towel, chances are they've got a minimal amount of oil, so you don't require as much as a second time. So, when applying to the region while facing in the supine position, you want to maintain that they're breathing, the aromatherapy if requested, and all the other comforts are considered. So when the regions of, say, the shoulder and neck are considered, you want to be sure that now, from this upward position rather than facing downward, you have a control, not so much the positive control we're worried about, but the amount of control towards the pressure. So that's the main concern and so forth. So we're trying right here and always in this pocket between the clavicle bone or collarbone, you wish to have right here. This pocket region right there is particularly sensitive and or delicate. This is where the shoulder straps for a lot of purses go. So between this region and the neck is particularly a place of vulnerability for a lot of tension and stress for women, as well as the bras and the wire that goes around the way. Elasticity and also much to the pressure we're worried about. So when applying the pressure right here, again, this is where you see a lot, if not the majority of the sensitivity for when you're trying to give the therapy. So maintaining that around, you want to go to the upper part of the scapula and or the shoulder blade, rotate slowly right towards the area which we described when the shoulder blade and the shoulder. And then there's the deltoid muscle around here. Giving a moderate degree of pressure is good for the deltoid because, again, this also helps with your range of motion, but not so much the particular area of concern. If it is their concern, of course, address the situation, but you want to maintain these areas, especially on the right and left side, at all times. Once that is complete, if they wish to do a scalp or focusing on the region itself, you wish to get what's called tea tree oil. Apply only a few drops. You wish to engulf, I would say, most of your hands and fingers, and going from the bottom of the neck. Ms. Jane, if you wish to lift up your head, please. Thank you. And then you'll want to get all the strands of hair, anything else causing any tension or any concern. There, you may lower your head, please. And then starting at the very bottom of the neck, the base of the neck, we call the axis because it allows you to rotate up, down, all around. It's called as the axis. And then once you get to this region, you're going to slowly, in a clockwise or counterclockwise motion, and then work your way up to right here, also known as the occipital lobe of the skull. And then you'll feel it going from softer to more rigid of the bone and the muscles. Once applying the pressure right here, you can move over towards the sides of the pressure points, specifically over here for the back and the side of the earlobes. Once applying the pressure right here, you can then use your other fingers and dexterity to increase for the scalp itself. The tea tree oil applies best to when working with the strands of hair and also towards the base of the roots. So we always promote a amount of collagen, we promote an amount of blood flow, but also much of just comfort and just relief. So when applying the scalp, you don't want too much pressure, unless of course directed by the patient itself, and then just in a slow clockwise, counterclockwise motion. And if you wish to go to the temple region, only at the patient's request, as that can cause some headaches and some other discomfort as well. So once applying to this region, you will then say, Miss Jenny, or the patient, will you please lift up your head slightly? And then slowly retract your fingers and hand, and then go down it with comfort and ease. The next area of such will also be towards the lower extremities. Also be sure that if it is tucked in under, or when the patient was rotating, make sure that all these areas are very much loose and having free flow air. One thing you don't have to do is restrict the patient's movements and or with the airflow, and swine will be able to maintain their body temperature to an equilibrium. So we have same input as before. We're going to rotate, get the comfort and access. So at the same time, we're going to get the oil. As before, if you've already gone over these regions and you've got majority of the oils wiped out from the hot towels, you don't need as much, but apply only enough that you feel is comfortable towards yourself and the patient. Same thing as before, because right now this is the largest muscle in the entire body, as well as the place where the pressure amount is going to be increased more than others. So when applying the oil, you wish to say that the joints right here in the popliteal and in the nerve endings towards the kneecap area too, you can apply pressure in another way, but remember, it's very delicate, as well as you only wish to go so much towards the pelvic region as such. Same motion, you're going to go from the lowest end to the highest, while maintaining that positive control, but also maintaining that understanding of what pressure and tension is in this area. So once applying total extremity, not only coverage and oil, you wish to see if there's any difference in comfort, or should I say difference in the tension, because when you're applying this in the upward motion, when you're bringing your pressure upwards rather than facing down, you want to be sure where in fact you either miss something and or is there any other region that would be to double check and or to go over again. So once you've done your exploratory, once you've increased right here, maintaining above the kneecap is extremely important, because in this area too, there are a lot of nerve endings, a lot of tension, but again too, this is the region all right here to which the muscle density is the thickest, all the body parts and all muscle groups. So this is where the weight is considered to be all the more a factor, especially for women whenever they're bearing children, and the hips. These things are very sensitive and such. Ms. Jennings, that discovered it right there? Again, if they wince, if they have anything like ow or just general pain that we understand too, then you do not go over the area. If it is to be lighter, then of course, but when you go over this region here, or anywhere else inside too, as it's intended for, nerve endings are very much in the sensitive area, as just described from the patient and such. So once going over this region, to go over it lighter and or to just give a general amount of care. So the hamstrings, of course, because you're going from the opposite direction now, you wish to be underneath right here, and again, sensitive to all nerve endings. So in this case, we're going to do it lighter and a little more delicate. Now, for the time frames on all these areas too, like I said before, if the patient is receiving a little bit more pain than usual and or discomfort, you can limit the time down and focus other areas and or spend more time on areas, as for say the scalp or any of the areas to go for. Now, when it comes time to lift up an extremity and or go this way, bending the knee slightly, that way it doesn't lock in the knee and or cut off circulation or blood flow to the artery. As in the form, this is the femoral artery, popliteal and tibial artery. So major muscle groups, major arteries, you do not wish to completely cut off circulation. You wish to have that balance and that bending of that knee, specifically towards when it comes to having a patient either having more pain and or just discomfort. And judging from the way she's a little bit more of a snooze, I should say, I guess she's understanding and very much relaxed, which is something we always achieve. So once that is wiped down with a hot towel, as you can see, we've done a very good job, so hey, we don't get paid to be second best. Now for the additionals, if you have a foot scrub, as stated before, only at the patient's request, you don't need the full extremity. You only need this area. So say mid-calf on down, taking your stool or your chair, whichever it is to, don't ever put this over the patient like I'm doing directly right now too. Why is that? I'm a big guy, but nonetheless too, I only have so much reach. Everyone's limited, but you never put the patient's safety at any risk at any time. And this is a massage area, so there's no need to rush. Go around the entirety of the bed and make sure proper placement is concerned. Once achieving the placement and or position you will achieve, you're then going to ask them to remove jewelry, any kinds of metal around the area too, because it will interfere, as well as we don't like to get oil over every single area too. We wish to maintain patient understanding as well as just the amount of area coverage. So sometimes they'll have some cloth wraps and something too. If it is not able to be undone, do not worry, just go around the best way possible. So once applying, you're going to remove everything. You're then going to do just one coat, just one over here, and you can apply to your hands as well. And then when you're going from the back of the Achilles tendon or the heel to the base of the foot, the ball of the foot, you're then going to go towards the arch and around, and sort of just a sandwich or a complete coverage in where the pressure is not going to be so much directed in the first. In the very beginning of any massage, especially with foot, you're wanting to get equal balance and coverage. So once you have that, reflexology. You wish to push the foot back all the way as possible while maintaining a very good even keel of the amount of tension, flexion, the muscle rigidity, and the elasticity. Remember, just like spandex, it can be stretched out to a certain degree to where we're trying to get that relief. Now, some people, or should I say most people, they have a tendency to be ticklish in this region. So if in fact you have some nails, if you're a female for instance, you want to be sure that you don't get all the nails and or certain areas of just, ticklish sensations. Now, if in fact they still wish you to continue after being a little ticklish, by all means, leave the least amount of nails, the better possible. So no nails, better possibility. After which you're going to say, do you wish to have a foot scrub to where you can have the amount of comfort, but also the amount of exfoliation. So I would say the same amount of time towards that massage, but you also say, okay, we want to have a little bit of oil, not a lot, but a little. And after which you want to wipe down completely with the hot towel, and then go from there to maintain they don't have any remaining salt. So please, at the end of any salt scrub, back, foot, anywhere, as least amount of salt as possible. That way when they walk out, it's literally walk out, they will not be feeling any more of a salt or anything remaining for the sake of comfort. Afterwards, we're going to cover up. And if you still have time on the clock and you wish to go over any other areas, it could be shoulder, scalp, neck, anywhere too, you can definitely recover or retract to these other places. But I think from our patient over on the table right now, Ms. Jenny, yeah, that's about a good response we always achieve here in the massage therapy. So at the 1 hour, the half hour, even 90-minute massage, you then double check, making sure that everything to the satisfaction end of your environment is good. You also want to maintain that if anything left out, say for instance any towels, anything that you need to put back into place or borrowed, make sure that's the case before the very end of the massage, making sure that once they do leave, they say, okay, right where I left you or not where I left you. So always maintain your environmental concern and areas of focus. So at this time, I guess we're going to wake up the patient because, like I said before, this is every massage therapist dreams, where the patient is completely out of mind and out of stress. So, Ms. Jenny, your 60-minute massage is all good. How do you feel?
Fall asleep.
Yeah, I guess there we have it. One happy customer. Okay, Miss Jenny, at this time we're going to give you some privacy to get dressed and to take on whatever you need to do. And the restroom is down the hall. And would you like some water, tea, or any beverages?
Water.
Water, please. Okay, ice cold. Okay, Miss Jenny. There you have it. Your belongings are where you left it. We'll be outside waiting for you.
Thank you.
All right, our lovely massage is concluded.